Hi, Dr. Soraya here. Today, in this series of psychiatrist comments on psych meds, I'm going to talk about Abilify. The generic name is Aripiprazole. Um, this is a medication that is commonly used for a few different conditions. It has uses for bipolar disorder. It can be also used as an adjunctive treatment for depression, and it also has antipsychotic properties, so can be used for psychotic illnesses, schizophrenia, and the like. Um, I would say, pragmatically speaking, it's mostly used in the mood disorders for depression as an add-on, often to SSRIs, or as a medication to help with manic symptoms, and also depression in bipolar disorder. Um, I think there are other options that I go to for psychotic symptoms before Abilify, so it can certainly be used for that, but I think that there are, as I said, there are other options that I go to first, and I mainly use Abilify um, probably predominantly as a add-on for depression. Um, but then there are certain individuals where they have more of a mixed picture in their mood state. So Abilify is good for people with mixed symptoms because it is good both for controlling manic symptoms as well as assisting in the treatment of depression. Um, for some patients, Abilify is uniquely helpful, and that's why I keep it kind of on my list of options, just because some patients that really don't fully respond to an antidepressant regimen, even with other augmentation strategies, will have a uniquely beneficial response to Abilify. The other time I think of Abilify is when there is some psychotic component. Usually people will have some kind of delusional preoccupation as part of their mood state, either some kind of body dysmorphia or a very exaggerated fear about a certain medical condition. That kind of delusional experience is often very responsive to adding on Abilify. Now, the dose range for Abilify is I believe it comes in 2 milligrams, 5 milligrams, and 10 milligrams. I'm not sure if there's a higher dose pill size, but depending on how you're using it. For depression add-on, I usually start at the lowest dose and just start by adding on 2 milligrams. Sometimes you'll end up going up from there. Probably not above 5 for most people if I'm using it for depression. Usually 2 to 5 is enough. For people with bipolar disorder, if we're using Abilify as more of a standalone, that's when I might go up to 10 milligrams. And I would say off the top of my head, it's pretty rare that I want to push above 10. And in fact, I try to keep the dose range down because Abilify does have a significant potential downside, which is that it can disrupt insulin sensitivity and glucose metabolism. And what this means in the real world is that people can gain a significant amount of weight on Abilify. Now, in my observations, it's been pretty variable. Some people just start putting on weight very quickly and will build up relatively quickly. Other people can tolerate being on Abilify without putting on significant weight. For a lot of people, it is just manifesting as increased hunger, increased appetite, increased cravings. So that is the main mechanism. But even for people who don't gain weight, you want to monitor their blood sugar and just make sure it's not causing any problems that are not necessarily manifesting in significant weight gain. But again, I have a subset of patients where they did gain weight, but Abilify was really the only medication that worked for them. So we have to kind of balance the weight issues with the other symptoms. And a lot of these patients, after lots of trials of other options, we end up coming back to Abilify and just institute a dietary and exercise program to deal with the propensity to gain weight. So coming off of Abilify, there is no significant withdrawal. As I've mentioned in other videos, I tend to taper, so if people are on higher doses, we will gradually reduce the dose to get them off, but there shouldn't be any significant withdrawal. The main side effect, again, is whatever symptoms the Abilify was treating are likely to come back. If that's often we're taking Abilify off because of weight gain, so it's there hasn't been sufficient time to kind of address the disease process. So often the original symptoms will come back and we'll have to try other options. And as I said before, we often end up coming back to Abilify because it does seem to be, for some patients, a uniquely effective drug. There are some newer medications that are similar to Abilify that work for some patients and are better in terms of not causing the same degree of weight gain. But so there are options for some patients, but they work sometimes and they don't others. Other side effects with Abilify, other than the weight issues, some people find it a bit sedating, although that's not a common problem. And then there is for any antipsychotic medication, there is something known as tardive dyskinesia, which I'll describe in more detail in a future video. But it's important to be aware of because it can be a potentially, or if you develop it, it's generally a permanent side effect that doesn't necessarily go away when you stop the medication and has to be managed. It is quite rare, but because it's potentially permanent, it's worth mentioning. I would say that for the people who benefit from Abilify, it's usually worth the risk just because, again, Abilify can be a uniquely effective option when a lot of other things haven't worked. And we turn to Abilify when symptoms are fairly significant. So using it is justified, and the patients definitely benefit significantly. Okay, thanks.